Hello everyone, my name is Jung-Ho Lee. My paper title is The Rehabilitation Effect of PNF after applying upper extremity taping on patients with central nervous system injuries. First is the introduction. A stroke is a disease that is accompanied by various symptoms as a result of the loss of cerebral function caused by cerebrovascular ischemia or bleeding. A stroke can occur various disability depend on damage location and intensity in the brain. Most stroke patients experience degradation in maintaining postural and functional movement and sensory balance and gait ability due to asymmetric body alignment. Neurological damage occurs after a stroke, which negatively impact not only patients themselves but also patients, families, and society due to the after effect of a complication. A stroke is a disease that should be urgently treated as a medical and social problem, as clinical symptoms of stroke such as motor disturbance and sensory disturbance and decreased consciousness and dysprasia and cognitive impairment can be found. In particular, patients with stroke has a functional disability performing the independent activity of daily living due to motor control impairments caused by muscle strength weakening and abdominal muscle tone and abnormal movement pattern. This impairment is followed by the limitation of functional performance level for activities such as walking and climbing stairs and self-carrying. Stroke leads to proprioceptive sensory impairment, and each lesion in the upper motor neuron degrades the body's ability to balance, which worsens over time as stiffness occurs. Proprioception plays an important role in neuromotor control and proprioceptor, which intervenes proprioception and are distributed in the muscle joint, ligament, and tendon and skin. It is divided into muscle receptors that are sensitive to mechanical stimuli, joint reception. Proprioception is information received from these three receptors. To explain this functionally, proprioception is information received at an unconscious level rather than on conscious level and is defined as the perception of posture and movement or balance change in relation to the body, as well as weighting and resistance against the specific object. Most stroke patients experience functional motor disturbance in the upper extremity, and this disturbance lasts for a long period. In particular, if the control of the voluntary muscle is lost due to the motor disturbance, an imbalance between flex and extensor occurs. As a result, stroke patients could not sustain the weight of their upper extremity due to the muscle paralysis in the shoulder and limiting the joint range of motion, as well as incurred shoulder subluxation and rigidity, resulting in the cerebral reduction in upper extremity function. The problem in the upper extremity occurring in stroke patients has a significant impact on the independent activities of daily living. Due to the reduction in control ability of the upper extremity as a result of rigidity and muscle strength weakening. The degradation in upper extremity function varies depends on the region of the brain that was damaged, which require constant management due to the disability caused by the damage. Thus, the important part of the rehabilitation in the upper extremity of stroke patients aims to improve the quality of life by increasing the remaining function through the minimization of the disabilities. The motor disturbance in the upper extremity due to stroke is one of the most general after effect and has a significant impact on the performance of daily living activity. Despite intensity and various therapeutic approaches, the recovery of upper extremity function of stroke patients is limited. Generally, the recovery of paralysis in the upper extremity is not better than that the lower extremity because movement in the upper extremity is the affected size are difficult due to the contracture and non-use of the paralysis extremity and muscle strength weakening and dysphagia, and the frequency of their use gradually decreasing. Proprioceptors that contribute to proprioception in the muscle and tendons reaction sensitively to the muscle length and the muscle tone via muscle spindle and tendon organ and the Golgi body, thereby playing an important role in the recognition, the movement, and the position of joint. Proprioceptors distributed in the joint are mostly found in articular capsule and ligament. They react the entire range of joint motion and provide proprioceptive sensory information that help co-activation stroke patients' movement. To have abnormal daily activities and improvement on the quality of life of hemiplegic patients due to stroke, efforts are needed to recover the performance of daily activity, muscle activity, and upper extremity function and negate the ability to the level before the outbreak of stroke through the recovery of physiological function in the upper and lower extremity in the affected side, or evaluation of weighting bearing, asymmetry, and improvement of postural stability. For hemiplegic patients, exercise to develop the central nervous system and such as proprioceptive neuromuscular facilitation has been applied for the general function recovery for the stroke patient. Although method to increase the function activity of the upper extremity and trunk strengthening exercise, the PNF upper extremity pattern has been widely employed in clinical field. Few studies have been conducted on the effect of taping with a positive impact on the increase of muscle strength and muscle re-education prior to applying the PNF pattern in relation to the upper extremity. So this study aimed to determine the effect of elastic taping applying to the upper extremity prior to PNF upper extremity pattern treatment on the rehabilitation of upper extremity function of stroke patients, thereby provide foundation data to improve the activities of their living in stroke patients. Second is a study method. This study selected 28 stroke patients who were treated in the hospital. The subjects who participated in this study were fully informed of the purpose of this study and the method, and gave their written consent to the voluntary participate. The study group were divided using the random selection method into the experienced group, consisting of 14 patients who applied taping prior to the treatment of PNF upper extremity pattern, and the control group consisting of 14 patients who did not apply taping prior to the treatment of PNF upper extremity pattern. Both the experimental and the control group in this study took the treatment using the PNF upper extremity pattern during the neurodevelopmental treatment. For the experienced group, elastic taping was applied to the upper extremity prior to the PNF. The control group just only using the PNF upper extremity pattern without applying no taping upper extremity. All therapeutic time is the upper extremity for 40 minutes too. Further assessment in this study prior to assessment were conducted before the therapeutic intervention, and then post-assessment were conducted after last treatment. All group has a total of the 20 therapeutic interventions 5 times a week for the 4 weeks. To apply the taping therapy to the upper extremity, taping for shoulder stability and taping for suppression of flexor muscle in the upper extremity were used. The elastic taping for the shoulder stability was applied to the deltoid and supraspinatus and infraspinatus and pectoralis major, and the taping for the suppression of the flex in the upper extremity was applied to the triceps brachii and wrist extensor. The PNF pattern used the upper extremity D2 flexion and D1 flexion and D2 extension and D1 extension, and the cupping pattern we used for the two treatment PNF. The Korean version of Fogel-Meyer assessment is a method used to quantitatively assess the functional recovery of stroke patients based on the recovery steps of motor function after stroke. The action research arm test is an evaluative measure used to assess the function of the upper extremities, and we was used SPSS version 18 was the use for the statistics of this study, and the mean and plus minus and standard deviation was described through the descriptive statistics. To determine the difference between the groups, independent sample test and the failed sample test were conducted to compare the result within groups before and after the intervention. Third is the study results. The FMA risk score has a statistically significant difference before and after the experiment in both the experimental and control groups. And the comparison of the difference in therapeutic effects according to the therapeutic intervention show no statistically significant difference between the experimental and the control group. Next is the FMA hand score has a statistically significant difference before and after the experiment only in the experimental group. And the comparison of difference in the therapeutic effect according to the therapeutic intervention show no significant difference between the experimental and control group. The ARAT score has a significant difference between and after before and after the experimental event in both experimental and control group. The comparison of difference in the therapeutic intervention according to the therapeutic intervention show that the experimental group has more statistically significant difference than the control group. Next is discussion. Elastic tape has a similar elasticity to that human skin. The principle and effects of taping therapy affect the skin and proprioception and muscle and fascia and joints. Taping increases the circulation of blood and lymphatic fluid via a skin lift-up action. After applying the taping therapy, taping lifts up the different layer of skin, feature relax fascia, thereby encouraging blood flow and lymphatic drain in the tissue. This can also decrease edema and increase the reabsorption of the substance that induce the pain by improving the recovery of the damaged portion of the body. Taping acts on the skin to deliver the contact stimuli to the sensory nerves present in the skin, and these neurological signals are sent to higher center in the CNS through the sensory nerves in the spinal cord. The blocking of pain through the stimuli of taping can be explained by the gate control theory. Because taping can transport stimuli at a faster rate than the nociceptor that receives and feels the pain, it can suppress the signal transduction by closing the gate. The muscle spindle reflex, which is one of the functions of taping therapy action on muscle, can recover the weakened function of muscle. Muscle tension can be increased by assisting the muscle contraction and each direction using the taps of the unique elasticity, and taping stimulate the Golgi tendon to suppress the overtension in the muscle and tendon, thereby helping the generation of optimal tension in the muscle. The proper tension in muscle can play an important role as a mechanism that controls posture and maintaining balance. If the muscle position which pain is not treated for a long time, compensation occurs in the other surrounding muscle and which induce the sensory damage or lead to constant chronic pain. Though offline can be effective not only to correct muscle function but also to prevent secondary damage. The application of taping therapy can treat joint damage by assisting or strengthening the muscle activity. Joint degeneration occurs because the excessive mechanical stress is put on the specific area without distribution the physical body load as the joint deviate. The abnormal load can wear off cartilage through the above series of the process, and additional stress due to the damaged cartilage can occur again, which creates a various cycle. Joint damage can be prevented by stopping this vicious cycle by entering the process of recovery. Third, joint can act in a normal position once the muscles are recovered to a normal state, and the joint range of motion can increase to improve circulation of blood and lymphatic blood, and thereby preventing and delaying degenerative joint. As mentioned above, the effect of taping therapy can be summarized in the sensor, and taping therapy can reduce the pressure on joint during exercise and increase the circulation of fluid and lymphatic fluid, which improve and enhance the motor function of muscle. The application of taping therapy is also an intervention that helps stroke patients exhibit near normal muscle performance. It is a therapeutic approach used to enable normal physical activity by attaching elastic and adhesive tape to a portion of human body along the directed of the affected muscle and fascia or to motor point. Taping therapy is also used to prevent further damage and protect damaged tissue and bring many positive effects in various areas such as clinical and sports medicine. Proprioception plays an important role in stabilizing joint. The muscle receptor playing a role of a converter to change the mechanical load into abnormal stimulation, a series of processes that are delivering neural information from the nerve terminal to the CNS, and the converted afferent information is integrated into the upper motor problem for accurate motor control, thus provide dynamic joint stability by generating muscle contraction and reflex. There have been previous studies conducted on proprioception. Afferent nerve of patients with hemiplegia due to the stroke were removed, and the proprioception sense were lost for a long period of time. As a result, they employed compensatory strategy or learned incorrect motor method. PNF is a therapeutic exercise method that combines a facilitation technique that induces physical body function, improvement of neurological and motor reaction with functional diagonal movement pattern. PNF can be used to improve muscle strength and endurance, such as stability and mobility facilitation, and neuromuscular control and coordinated movement. It can also be used to strengthen weak muscle group by facilitating strong muscle group using the diagonal movement pattern through the stimuli of many sense of facilitate or strength, motor reaction, and recover function. PNF can be used in all steps of rehabilitation, from early step where isometric exercise can be applicable, and to step where patients can resist it and move at faster speed. Currently, it has been widely applied in sports medicine to treat damage to the CNS and peripheral nervous system and orthopedic and neurosurgical disease. PNF can activate muscle on the affected side by applying to the upper and the lower extremity. On the unaffected side, when muscle strength of upper and lower extremity on the affected side are weak or not formed, were encouraged at the early onset of stroke. PNF can strengthen using the scapula and pelvic and neck and forelimbs, particularly when PNF is used by holding the other hands of the affected and moving both hands together. The trunk strength. This pattern is introduced as a cupping and lifting pattern. The cupping pattern can stimulate the external oblique abdominis and rectus abdominis in leading more direct, and the international oblique abdominis in the trailing direction. The trunk and upper and lower extremity in human movement act together as a form of complete synergetic muscle, and irradiation occurs from stronger to weaker muscles through the resistance of pattern that strengthen the upper and lower extremity of trunk. A study on the electromyogram of PNF arm pattern reported that diagonal movement using arm among PNF technique improved the functional activities of the upper extremity and stabilized the trunk muscle. Another study reported that activating the pectoralis major muscle and the serratus anterior muscle feature accessory respiratory muscle and influences the increased activity of the respiratory muscle. The present study applied PNF technique and taping technique together. which were both widely used in clinical field as a therapeutic intervention for improving proprioception. The study results showed that experimental group who applied the PNF and elastic taping that could lead to improvement in proprioception, improved function activities, and has a significantly higher result than the control group. This result was obtained because the synergy effect of two interventions that maximize the proprioception stimuli. For future studies, the synergic effect between the therapeutic intervention on improving the intervention by stimulating the ability of factors in relation to patient function will be investigated. This is my PPT is the end. Thank you for your operation. Thank you.